to be talking, and we'll get into a bit more on that in just a few minutes. But if you would like to join the conversation, we invite you to. A lot of people, I'm sure, have some questions about the things we're talking about today. Give us a call or a text at 920-887-8585, or call us at the studio line at 885-4446. Amanda, thanks for being with us this morning.
Thanks. It's my first time being solo. I don't have my colleagues with me today.
Oh, never before, huh?
No,
Interesting.
that's the first.
Well, Jenny, who is usually with us, but she's with us in spirit
She is.
today.
She actually said the same thing.
She did bring you a note, a joke to share with us, as she usually does.
Yeah.
So, Jenny's joke of the month.
Yes, it's very timely with Halloween being next week. So she gave me, what does a turkey dress up as on Halloween?
What does a turkey dress up on as Halloween? Ah, boy, I'm stumped.
A goblin.
Okay, all right. I suppose so. Yeah, that makes sense.
I guess I don't really hear a whole lot of dad jokes that have to do with Halloween, so that was kind of cute.
Well, here's no joking matter. Your agency has a new email address.
Yeah, we just decided to make it a little bit more simpler. I think it used to be hsaging@co.dodge and then the rest of it. But we're not just an aging unit anymore. We're aging and disability. So it's just the acronym for our agency, which is Aging and Disability Resource Center. But you just type it out, ADRC, and then it's the rest of the normal Dodge County email address, which is at co.dodge, dodge.wi.us. But if you accidentally email the old email, it will still be connected with the new one. So no worries, but we just wanted to simplify it.
Yeah, it is a lot simpler, a lot shorter, and ADRC is how people know you anyway, so that's a lot more direct.
Yeah, I think it was the HS Aging Unit when we were still underneath the Office of Aging before the ADRCs came to fruition. So, yeah, new email address.
Very good. We'll be talking a lot about this throughout the show, but we should probably just mention off the top that open enrollment time is upon us now, and that's a busy time for you and a busy time for people who, get services like Medicare.
Yeah, there's a lot of different types of open enrollment. The first one I just had on the list, it doesn't start for about a month or so, but it's the Marketplace open enrollment. So the Marketplace is Obamacare, the Affordable Care Act, kind of all these other names that mean the same thing. But that open enrollment starts November 1st through December 15th if you want coverage to start January 1st. But technically, you have until January 15th to make those changes, but then that new coverage won't start until February, if that kind of makes sense.
Very good. So if you want your coverage in January, now's the time to start thinking about what you want.
Yeah, and the Marketplace is available for people who have no access to other health insurance. So it's not available for people who have Medicare, Medicaid, and employer-sponsored health insurance. Again, it's just for those people that don't have that other insurance. To apply, you need to know your household size, your income, and your current health insurance coverage. That's just going to be asked just to weed out those people that have access to that other health insurance. And then just a new thing that I came upon is that you have to verify your continued eligibility for the subsidized plans. And it's the silver plan and above through the Marketplace because they call them metal tiers, bronze, silver, gold, platinum. So it's those subsidized plans. You have to verify your eligibility. If you don't, you will be charged a $5 premium until you confirm or update that eligibility.
All right, very good. So we have a lot more to talk about, but we're going to take a quick break here and be right back. You're listening to Community Comment on 95.3 WBEV, powered by Daily Dodge.
And welcome back to Community Comment on 95.3 WBEV. Here is Terry Bell.
Thank you, Ashley. Amanda Higgins with the Dodge County Aging and Disability Resource Center is with us today. And we're talking about a lot of important things, especially as they pertain to signing up for, say, Affordable Care Act coverage or Medicare coverage. Open enrollment season is just around the corner, and now is maybe a good time to start thinking about what you would like to get all your ducks in a row. So if you have any questions for Amanda, you can join the conversation by calling or texting 920-887-8585, or you can call our studio line at 885-4446. And it's especially important, all those things I just mentioned, Amanda, because there are some changes coming to Medicare Advantage and to Part D, and you want to be faster than slower when it comes to thinking about that.
Yeah, so not last week, but the week before, Jenny, Ashley, and I, we sat through 9 hours of training on the computer. Good thing it was kind of spread out amongst 3 different days, so it wasn't 9 hours in one day. Otherwise, I might be a zombie. But we just learned about a lot of the updates and changes that people can expect for next year. There are some plans that are going away with the standalone Medicare Part D and the Advantage plans. So there's I would say about a handful or so within those 2 different areas of Medicare that are going away, and those non-renewal notices was mailed out to all beneficiaries in September. And so those beneficiaries would have gotten 1, maybe even 2 notices letting them know that those plans were not going to be around for 2026. So what that means to all of those beneficiaries is they will not be auto-enrolled into a new plan. So it's going to be very imperative that those people decide and make some sort of choice of what they want. Otherwise, they may be going into the new year getting their medication specifically in January and not being aware that they have no coverage. So we just wanted to make people aware of that. I'm going to probably sound like a broken record during this show, but open your mail, read it. If you don't understand it, please either call your plan, call our office, call Medicare, call somebody so they can kind of better understand or better explain to you what that means and what your choices are. So a couple things that people can do for those plans that are not renewing, they're terminating. They can use the open enrollment period to look for a new plan and make an enrollment, and that enrollment will go into effect in January. So you'll still have that plan for the rest of 2025. It's not going to go away now, but this is just giving you notice that you need to do something. So that's the first thing that you can do. There is going to be a special enrollment period specifically for those beneficiaries that were in those plans that are terminating. And that special enrollment period goes from December 8th through the end of February. And depending on when you make your coverage change, it will begin the first month after enrollment. So if you decide that you realize that you didn't make a decision during the traditional open enrollment and it's December 15th and you're like, oh shoot, you can still do it and the new plan will still start in January. If you make a switch in January, it won't go into effect until February. So there's going to be a little bit of a delay in coverage, which could be costly for some people depending on their medications and other medical services. The third thing that people can do, and we don't see this too often, but they can use what's called a guaranteed issue provision to buy a Medicare supplement. So if they were in a Medicare Advantage plan, for example, and that Advantage plan is leaving, it's no longer continuing for 2026, they can use this to buy a supplement, and the supplement company will not ask them health underwriting questions. The catch, though, is that, because there's always a catch, right? You are only able to use it 63 days from the end of that policy. So it's still timely that you should be doing something.
Okay.
A couple other things I just wanted to share. So I have a list that I got during training.
All right.
That just goes over all of the standalone Part D plans that are ending, they're terminating. So there are 2 Anthem Medi-Blue drug plans that are terminating completely, along with Cigna Healthcare Extra. Those 3 plans are no longer going to be continuing, so those 3 plans that have beneficiaries, you'll have to do something. There's another Cigna Healthcare plan that's just changing their name. So instead of Cigna Healthcare, it's just called Health Springs. So just a name change there, along with another Cigna plan. So instead of Cigna Healthcare, it's just Health Springs. And then we have 3 WellCare plans, but the WellCare Medicare Value Plus plan, that plan is going away, but because there's still other sister plans within the same parent company, they can move people to a similar plan. So people that were in the Value Plus plan are going to be what's called crosswalked into the Value Script plan. So you still want to make changes because even though you're being slid into a different WellCare plan, there's no guarantee that that plan is going to work for you as good as the Value Plus plan. So we've been saying this for a couple different shows, but you want to be a good consumer and just look to see what your options are because you won't know.
Right, and I have to imagine a big part of your duty is to help people out who maybe they've had a plan that works well for them, provides what they need, and the price may be right for them, but then it goes away. And then they have to start this whole process, and a lot may have changed since the last time they had to make all these decisions.
Yeah, another big thing that I just wanted to mention to people is in the Medicare Advantage plans, Quartz, which is a parent company of multiple plans, but Quartz is going away completely, and it's affecting like 34 or 37 different counties in Wisconsin. So in Dodge County, there were 3 Quartz Advantage plans that had drug coverage and 2 of them that did not have drug coverage. All of those plans are going away completely. So again, read your notices and reach out for help.
Yeah, for sure. Yeah, I've heard from people who are in that situation who have been Quartz customers, and now they have to, I don't know. But they're getting a lot of information, a lot of help, but still has to be a little daunting.
Yeah, and nerve-wracking. I mean, if this is not your first language, if this is not your profession or something that you are really interested in and are reading up on all the time, it's like a foreign language, and you're just kind of like on your own island, not quite sure what to do. But there's definitely help available.
Very good. So be sure to be on top of that if you were a Quartz customer, if you were with Medicare Advantage or Part D. Those are going away in 2026. Anything else we should know?
I guess another piece of mail that people should have received from all of the Medicare plans, the standalone Part D or the Advantage plan, it's called the Annual Notice of Change. Per Medicare law, it has to be mailed out by September 30th. So people either should be receiving these now or they should have received them a few weeks ago. The Annual Notice of Change, I can tell you that it's not friendly to read, and it's just giving you a very high-level overview of the plan changes, like maybe what the premium difference is going to be, or if they're changing a deductible, or maybe Tier 1 medications are going from $5 to $7. The problem is it's not going to be individualized. It's not going to say, Terry, these are your 5 medications, and these are what the cost changes are going to be. It doesn't even say what medications are in Tier 1. It just says these are the changes, call your plan for more information, which you can. But another fantastic tool is the Medicare Plan Finder, which is on the Medicare website, that can give you very similar information than just calling your plan.
Yeah, outstanding. So we have all of that, and the question just escaped. I had a question on the tip of my tongue, and it escaped my.
I hate when that happens.
Yeah, I know. I hate that too.
It's like your brain falls out.
Sometimes. But the main thing is I guess now I remember what I was going to ask. You'll always be contacted by U.S. mail, all this correspondence. I think if you're looking out for scams, you probably want to avoid high pressure, unsolicited emails and phone calls and texts.
Very legit. Yes, phone calls, text messages. We even see that people get like postcards in the mail, but if you look in the fine print on one of the sides of the postcard or even just like a flyer, it might say like this is not a government sponsored advertisement or something, and then it will say also in little font whatever that third party marketing is. So I think that's a very good point. With this day and age, with some bad actors out there, you really have to protect yourself and to protect what information you're getting.
Very good. Speaking of information, we're going to take a break here to take care of some business, including the news, but we will be right back. You are listening to Community Comment on 95.3 WBEV, powered by Daily Dodge.
Join us for our first Pack Attack party of the season, Sunday, November 2nd at Tower Lanes in Beaver Dam. Registration starts at 11 a.m. and kickoff is at noon. Watch the game on one of Tower Lane's many TVs as Green Bay takes on Carolina. Register to win incredible prizes, including McKinstry's Home Furnishings Best Seat in the House and more. Partake in the meat raffle going on all game long and enjoy a free meal at halftime, courtesy of Pizza Ranch in the market at Beaver Dam. See you Sunday, November 2nd at Tower Lanes. Check out dailydodge.com for more info.
Real estate isn't just about buying or selling a house. It's about finding the right place to call home. At Klodowski Real Estate, we're more than realtors. We're part of this community. We understand the local market and we take the time to understand you. Whether you're a first-time buyer, downsizing, or just ready for something new, we're here to guide you with no pressure and advice you can trust. Klodowski Real Estate, your trusted real estate advisors. Visit KlodowskiRealEstate.com or call 920-219-9212 to get started.
Hey, it's Stacy from Slumberland, Beaver Dam and Watertown. Stay tuned to my friends here at 95.3 WBEV, powered by Daily Dodge, live from the Slumberland Furniture Studio.
Barry Bell.
Thank you very much, Ashley. We are talking with Amanda Higgins of the Dodge County Aging and Disability Resource Center. Open enrollment time will soon be upon us, so there are a lot of important things to talk about in this program. If you have any questions, and I imagine there are a lot of people with plenty of questions or a comment, go ahead and call us or text us at 920-887-8585. You can also give us a call right here at our studio line at 885-4446. And just to underline the point, Amanda, we just heard on the news a lot of things that are happening in the news that are, affecting the people you serve and the things we're talking about today.
Yeah, I was just telling Tara at the break that one of the volunteers that we have for open enrollment, she's going to have to jump on to the Affordable Care Act or Obamacare. And even though it doesn't open for those changes to be made until November 1st, she started to look on the website just to see what is out there for plan choices and to start doing her research. And she's one of the women that are just very proactive and on top of things. And I think it's causing her lots of anxiety because there's nothing out there yet. And we just ironically heard on the news break from ABC News that I think a lot of the information isn't available because of the delay with the premium tax credits, which during when we had the training, I had it to the understanding that it was all of the premium tax credits that were going away, and that's not true.
Okay.
It's the advanced premium tax credits that are going away. The traditional premium tax credits will still stay, but the advanced tax credits are for people between 300% and 400% of the federal poverty level, which is potentially a lot of the retirees, depending on how they have their income stream set up, if that's really going to be impacted. Actually, my parents, they retired a number of years ago, but they were able to stay on their employer's health insurance through paid up sick credits and stuff. And they can continue, but they would be funding the entire premium on their own. So they were going to jump over to the marketplace. And my stepdad, he actually is delaying that choice because of the uncertainty with the marketplace. They're just going to pay the higher premiums through their previous employer just because they want more time to make those choices.
Sure. I'm guessing it's a confusing and concerning time for a lot of folks.
Yeah, so I guess, again, to be a good consumer, just, pay attention to the news. The benefit specialist at Aging and Disability Resource Center, we know, I feel like, enough to be dangerous with the marketplace, so we really don't do a whole lot of unbiased counseling with the marketplace plans or help people with enrollment. We can just give more factual information and help people understand how to navigate that process. But, reach out to your insurance agent. There's also a really good unbiased agency in Wisconsin called Covering Wisconsin that can help with the marketplace. So yeah, just keep your ears to the ground and reach out and ask lots of questions.
Yeah, in fact, you underlined that point. There are brochures going around specifically talking about, the fact that the ADRC is a source of unbiased information.
We're not insurance agents.
Because, yes, if you're not careful, you may find yourself talking to somebody who's going to try to sell you something that might not serve you well.
Potentially. I mean, I think there's a lot of really good insurance agents out there. It's just those couple bad actors are making people, I think, a lot more nervous. So,
yeah. Or somebody who maybe isn't even an insurance agent at all, maybe just someone who's just posing as one to take your money.
Yeah, for sure. Yep, so we're free and unbiased.
Very good. And how do they get in touch if they would like information?
Feel free to email our new email address at adrc@co.dodge.wi.us. Feel free to go on our website. If you just Google Dodge County, it should come up the first couple sites. And actually, I think, what's today, the 21st? It's either tomorrow or Thursday, Dodge County is going to be getting a brand new website. So you'll see some changes on there. But all of the information will stay the same. It's just going to be easier to navigate. Or feel free to call our office directly at 920-386-3580.
Now might be a good time to talk about the Medicare Plan Finder tool enhancements.
Yeah, I roll my eyes because Medicare, they're calling these changes enhancements. For those who don't know, if you go to the Medicare.gov website, there is a button that says Find Health and Drug Plans, and that actually takes you to the Plan Finder. So there's nowhere on the Medicare website that says this is the Plan Finder, but that's what the tool is called. And Medicare has added some enhancements, so I just thought this would be appropriate to explain some of those because people can use the Medicare Plan Finder on their own, so I think it's helpful to understand what these look like. The first one that we have seen for 3 or 4 months now is if you create a brand new account, you have to provide an email address to connect it with the Medicare account. And so any existing accounts don't have to add an email if they don't want to. So it's just those brand new accounts. And then also another enhancement, and I understand because of all the scams and fraud that we're seeing, Medicare is adding what's called a multi-factor authentication, or MFA. So if you create a new account, it's essentially going to send you either a text code or it's going to call you and give you a code over the phone that you have to enter in to finish the setting up. And the thing that I was looking at during these enhancements from Medicare is that you don't need that multi-factor authentication now, but it's going to be required for every single account, old and new accounts, after open enrollment. So unfortunately, I think that's going to provide some more barriers for advocates like myself to help Medicare beneficiaries, because instead of doing work on their behalf prior to the appointment, we're going to have to do everything live because we're not going to be able to get into that account until they give us the code. So I get it, but it's just going to be a few more steps. There is a new provider network search. So for those who are in Medicare Advantage plans, and as advocates, we've been saying this for a long time, that it's really hard to give people good plan detail information if it's easier in terms of figuring out what providers are covered underneath what plan. So there is a new network search tool. And even though Medicare claims that this new enhancement is accurate, there is a possibility that some information may be inaccurate. So Medicare has already set up a special enrollment period for people who made a plan decision, enrolled through the Plan Finder, and then come January, they realize that the provider information is wrong. If it's wrong, then Medicare can grant them this special enrollment period to change their plan just because of that search tool. So the caveat, though, that we've been kind of talking about as advocates is, one, you have to make that plan change through the Medicare website so Medicare can track that the misinformation came from the website versus another source. And then we are encouraging people to either print off or save their plan results with a date stamp on it. So then we can also provide that as evidence to Medicare if we have to use this special enrollment period. And it's only available the first 3 months of 2026. Sorry to go into a lot of detail, but another enhancement is enhancements or more information to those supplemental benefits. So if you go on the Medicare Plan Finder, you look at the health section, the drug section, and then towards the bottom, there's a section that's talks about supplemental benefits like dental, vision, hearing. This is where you got some very general information about like those over-the-counter cards and like the fitness benefit. Some of the new benefits that are listed is wigs for hair loss related to chemotherapy, if the plan provides that as a benefit. Weight management programs, and then also home-based palliative care. One thing I really want to mention here when we had training a couple weeks ago is, and I think we've talked about it on some past shows, but those flex cards for people to get extra groceries, help with their utilities, other extra benefits for over-the-counter medications. There was a program that was funded through the Medicare Trust Fund. It's not that anybody needs to know this, but it's called a value-based insurance design model. That's ending. So all of these people that were getting $130 a month for groceries or over-the-counter, some of the plans were even offering help with rent or other housing costs. All of that is ending. It was just costing the Medicare, well, one, it was kind of more of a pilot program, but also I don't think that Medicare realized how much it was going to cost the Medicare Trust Fund. So that's going to be eliminated next year. There could be plans that offer some of those extra benefits, but you have to qualify for them instead of it just being available to everybody. And they're saying that the plans will have to go through like an interview to see if you qualify based on a chronic illness. So if you have a chronic illness, the plan determines that, I'm guessing, through probably doctor verification. You could be getting some of those extra benefits, but for the majority of people that were using those flex spending cards, that's going to be ending. So that should also be spelled out in that annual notice of change that plans are sending. And then the last other thing that's going to be impacting a lot of people is the elimination of $0 copays for medications. And that's really only for people who have extra help or some extra financial assistance to lower their drug costs. So that's also going away, but they'll still get the traditional extra help copays, which is, I think, $4 for generic and like $9 for brand name. So it's still going to be a discount versus the full cost of the plans. It's just not going to be all the way down to zero. So I think that in itself is going to be a huge impact during this open enrollment. Just a couple more enhancements that Medicare is talking about is if the plan offers, specifically Advantage plans, if they offer a premium reduction for Part B, that's going to be indicated on the plans, which it never has been before. There's going to be some new star rating information, so if people are making a decision based on how well the plan is performing, there's going to be some more data to explain how the plan got that star rating. A better way to filter special needs plans, so if you wanted or didn't want to look at those plans, there's just a little toggle switch at the top that will allow you to see plans better. And the last thing is Medicare is talking about redesigning their landing web page to make things more easier to navigate.
Very good. We're talking to Amanda Higgins of the Dodge County Aging and Disability Resource Center. We need to take one last break, but we'll be right back. You're listening to Community Comment on 95.3 WBEV, powered by Daily Dodge.
Throwing the right.
And welcome back. You are listening to Community Comment on 95.3 WBEV. Here is Terry Bell.
Thank you so much, Ashley. Our guest today is Amanda Higgins with the Dodge County Aging and Disability Resource Center. If you have any questions for Amanda, we still have a few minutes, so you can join the conversation by calling or texting 920-887-8585. You can also call our studio line at 885-4446. And people have an opportunity, Amanda, to pay some premiums starting in December with their Medicaid purchase plan.
Yeah, there were some updates that are being implemented slowly. So Medicaid is just this really big umbrella in the state, and Medicaid is state health insurance for people who have low income and assets. And depending on income, assets, if they have a disability, they're kind of filtered into all of the programs to see which one is going to stick. And these updates are really pertaining to only the MAP program, the Medicaid purchase plan. And the big change that's happening, it's going to start in December, but it's going to allow people a little bit more flexibility, some extra time in paying their monthly premiums. Not everybody in MAP potentially pays a premium, so it's really going to be affecting those that do. And right now, today, like if you don't pay your premium for the month of October, you could be disenrolled because of non-payment. So now these changes are going to allow some more flexibility, essentially an extra month for people to pay premiums. But you don't want to get too much behind because it's going to all kind of snowball on top of each other. So this flexibility in paying premium, it's going to start in December. But what's going to happen is November 18th, there's going to be notices that are going to be mailed to everybody that's on MAP that has a premium indicating this change. Then in December, the premiums are due. And then you essentially have until the end of January to pay for a December premium. So that's going to be kind of like a slow back date of premiums, but it's going to prevent a lot of people from being disenrolled just because of not paying those premiums timely. So it's just giving people an extra cushion to do that. However, if people don't pay their December premium by January 31st, they will be disenrolled from MAP. So just because you have extra time to do so, it doesn't mean that you should just ignore this completely. So make sure to read your notices and making sure that you're asking questions to make sure that you understand what the parameters are. There's a couple other changes that are connected to this. With this change, it's allowing recurring premiums. So if people have a $35 monthly premium every single month, starting yesterday, they're able to set up auto pay through, it's called Access. You can either do Access through the computer or through an app on your phone, and you can set up those auto pay so you don't forget to pay. And you can either set it up through deductions from your paycheck. I forget what the acronym is that the consortium calls it, or you can set it up from direct payment from a bank account. The other thing that is going to be affecting new people enrolling into MAP is today, if you enrolled into MAP, you're able to pay that first premium through the local agency at the counties, and now you're not able to do that. You can pay premiums by mail, setting up that direct deposit, or sending in a money order to their post office box. And then let's just see here. The other thing that this update is doing, it's preventing duplicate payments. And so I think it's for those people who, are a little delayed in paying the premiums, but they're not paying too many premiums at the same time. So this new process is going to prevent any duplicate payments. So people aren't going to be paying double premiums by mistake. So all of these notices with the MAP updates, they're going to be coming out in notices from the CDPU. The mailing address is in Janesville, so check your mail, read your mail. There's also a lot of great information if you go to the Wisconsin Department of Health Services website and you click on the MAP program. There is a whole timeline of what those specific dates for this new rollout to expect. So go on the website, and if you're bored, look up what the changes are for the MAP premiums. But I think this is going to help a little bit more than paying those premiums than what it is now.
Okay, shifting gears just a bit, your agency is looking for some volunteers to help you carry out your important work.
Yeah, so when I reached out to see if there was any other programs or updates that I should be sharing on the radio, all I was told is a lot of our programming for those like evidence-based classes, we're slowly starting to kind of wrap things up for this year. So there's classes that are going on now, but we're not going to be starting any new classes between now and December. We'll have some new stuff coming out in January. But our nutrition coordinator in our transportation program, they are in desperate need for volunteers. So in the driver department for transportation, sorry, hold on, I'm just reading this. Actually, this is for meal site drivers.
Okay.
So if you are interested in delivering our home delivered meals, we need a Randolph driver on Tuesdays and Fridays, Lamira driver on Thursdays and Fridays, and a Reeseville driver on Wednesdays. They're also looking to see if there is a volunteer driver that wants to be a float. So if we just need fill-in any part of Dodge County because of, maybe a vacation or someone sick for the day. So they're just wanting to see if there's anybody that's wanting to be just a float nutrition driver. And then we're also looking for a paid position at the Mayville dining site for a site coordinator to cover on Mondays and Thursdays. So we have a lot of volunteer opportunities, but we're also looking for a paid position at the Mayville dining site. So if you are interested in any of those positions, if you want just information because you're not unsure of commitment or whatever the case is, please call our office at 920-386-3580.
And when it comes to those volunteer positions, you'll work with people in terms of their schedules. You won't be, overwhelmed by the time commitment.
No. I mean, I'm just looking here. If you are able to do the Randolph route, but only are available on Tuesdays and not Fridays, I think at this point we're going to take what we can get because when we have those holes in the schedules, then it's staff that's at our office that have to just jump at it right away and put the rest of their to-do list for the day aside because that's going to be more important. So yeah, at this point, we're not going to be picky. All of the volunteer drivers are paid mileage, so they would be driving their own vehicle. We do not have a huge fleet of vehicles, so you'd be driving your own. You'd get a little magnet to put on your car that says that you're driving for the Dodge County Aging and Disability Resource Center, and then you just record your mileage and turn it in every month.
Very good. We're all out of time all of a sudden.
Yeah.
The hour went by quickly.
It always does.
Amanda Higgins of the Dodge County Aging and Disability Resource Center. If people want to get in touch, they can reach you at ADRC at co.dodge.wi.us.
Yes, let me just make one more call out for the Medicare open enrollment. We do have packets that we're asking people to fill out if they want that unbiased assistance from us. So feel free to call our office and request those, but they have to be physically returned to our office by November 21st, just so we can guarantee that we'll be able to get you in for an appointment.
Very good. Thank you so much, Amanda, and thank you for listening. This has been Community Comment on 95.3 WBEV, powered by Daily Dodge.
This week's Mid